Carolyn, the state right now, at least in southeast Michigan, remains in phase 4 of the reopening plan, but Governor Whitmer was very clear today she will not hesitate to move us backwards, even, she said, if it means kids don't return to classrooms in the fall.
If we let our guard down, we could see a rapid increase in cases and deaths here in Michigan.
After weeks of steady decline, cases of COVID-19 in Michigan are moving in the wrong direction. More than 600 were reported yesterday, nearly 450 today. Helping trigger the new cases, the governor said, are young people.
Statewide, 1 in 5 cases are patients that are between the ages of 25 and 34. So, youth will not protect you from carrying and spreading this virus to your friends and family and neighbors.
The governor did not announce a step back in the state's reopening plan, but said if this trajectory continues, she will. It could affect whether schools reopen in the fall.
So if we're going to get our kids back in school in 8 weeks, we've got to at least stay in phase 4, if not move into phase 5, and on the trajectory we're on, it's very much in question.
The state's contact tracers, who track people who have been exposed to or infected by COVID-19, have been busy. While they've built up a team of over 10,000, they've only been able to reach 60% of the contacts they've traced.
If someone from your state or local health department calls you, please answer the phone. If you've tested positive, it's important that we understand who you've been in contact with.
And the governor said we can't wait for the pandemic to be over to address the health inequities hurting people of color. While African Americans make up just 14% of the state's population, they account for 40% of COVID deaths. Whitmer blames prejudices that unknowingly influence just how health care is provided.
I've asked our medical partners and universities to incorporate implicit bias training into their curriculum, so that as people of color seek health care, they'll be treated with equal dignity and respect, which will yield better outcomes.
Through an executive order, the governor will require implicit bias training for medical professionals statewide.
You have the opportunity to be that different set of people that make a different set of choices, that establish a new set of systems and a different framework and a different paradigm that can lead to a different set of more equitable outcomes.
Now, that implicit bias training will not begin immediately. The state says it's going to take at least 6 to 12 months to get those new rules on the books before we start seeing that take effect. We're live downtown tonight. I'm Ross Jones. Alan, back to you.
Yeah, Ross, you know, a lot of health officials are always urging people to wear masks, but still people refuse to wear one. Do we know what steps the governor could take to try to encourage people to wear masks?
Well, she said today she's very frustrated by this. Obviously, we saw those images of folks on a lake recently not wearing masks and in very close contact. She said the state does have the power to levy fines and people could be charged with a misdemeanor. She had said we've tried to resist that so far, but expect an announcement in the next few days where the state will try to tighten those rules somehow. We'll have to wait and see.
Yeah, we definitely all have to do our part to reduce the spread and slow those numbers down for sure. Right, Ross? Thank you. Carolyn?